Hey everybody, this is Dan Buglio with Pain Free You, and I am thrilled to have Patricia Korbackova here, and she is from Slovakia, and she has decided to share her story with recovery from trigeminal neuralgia, and I'm thrilled to have her here. And trigeminal neuralgia is a community that I believe sincerely is mind-body TMS related, and we don't have a ton of success stories. And in my opinion, I think a lot of that has to do with the community itself, the fear levels, the um, just the medical diagnosis, and I guess it's a little bit more challenging due to the severity of the pain for people to get on board with the fact that the brain can actually be creating this level of pain. So I'm thrilled Patricia is here. I'm thrilled she's willing to share her story. So I guess let's start by just kind of saying, what was going on and when did this all start? And
hmm
you can kind of roll into how long this was going on, maybe some of the medical things you've tried. Um, and then at some point, you probably heard about either Dr. John Sarno or the mind body connection. So kind of lead us into, where you were, what you found out, and we'll figure out the rest of the conversation from there. So thank you.
So what happened is I don't even know where to start, but I guess I'm gonna start from the beginning.
Sure.
Is that it was probably February 2019, and I just finished my MBA in December, and I was thrilled to finish my master's, and I was living in New York. And I was very excited to just launch my career, and I just like wanted to finally get into the whole. I mean, I already had some experience in entry level positions before, but I was just excited to kind of launch my career in New York and ready to job search and find my dream job and all that stuff. So in December, I finished my master's, and it was like January, and the job search wasn't going so great. And February was hitting, and I still wasn't able to find a good job in New York City. It's very competitive. So I kind of was down on myself because there was so much stress. There was financial stress, and there was a stress because I felt like I graduated with an MBA for nothing, and how am I gonna, kind of get into this career? And so there was doubts that I had about myself personally, and then obviously the whole stress of living in the city like New York, tons of loud noises. There is ambulances everywhere all the time making sounds. There's people screaming on the street. The apartments in New York are very loud in general. The insulation is horrible. Then you have problems with like rats.
Oh,
If anyone ever lived in New York, they know the pest is a problem there. So you have so many things going on. There's just so many things going on in a big city like that. You're either dealing with a pest problem or with loud noises or your landlord, or it's just always something. So it's kind of stressful to live in a big city like that.
certainly.
Um, so it was February, and I started to have pain in my wisdom tooth. I previously had one wisdom tooth taken out a year prior, but this time it was another one that started hurting. So I just went and, well, I assume it was a wisdom tooth, obviously, because the pain was radiating into my jaw. So what else would it be? There was a wisdom tooth located in that side. So assuming that, I went and visited an oral surgeon, and they performed a partial wisdom tooth extraction. And that just because the wisdom tooth was so close to the nerve, they couldn't take out the whole tooth. So part of it stayed there. And the pain was still there after the wisdom tooth surgery. So at this point, I was very confused. I'm like, the wisdom tooth is out. Like, what's going on? So I told the oral surgeon, hey, the part of the tooth is still there, and that's probably the reason why it's still hurting. He's like, no, there's no reason for it to hurt because we took the majority of it out, and the one that was kind of poking at the gum, that part is gone. So there's nothing to be hurting. Like this part that's there, it's far inside of your jaw, and we didn't want to touch it because it's close to the nerve. So what happened is that I made him take out the rest of it. So I made him take out the rest of it, and he did, because by that time, it was a couple of weeks later, that part of the tooth migrated and was farther away from the nerve. So he said, okay, it's safe to take it out. So we took it out, and the pain was still there. So now the whole tooth was out, the pain's still there. All right, what's next?
Right.
I don't know what else to do. So I kept complaining to him, like, you took out the rest of the tooth, and it's still not healing, and I don't know like what's going on. And on top of that, I got this crazy rash on my chin after the surgery and in my thumbs. He's like, oh, it seems like your immunity is lower. It could be like some type of herpes or something like that. We'll just give you like antiviral medication. And we're not sure what that is, but it seems like your immune system is overreacting after the surgery. So I'm like, okay, maybe that's what it is. Maybe it's just like this rash is making it very painful, and the wound is not healing. So that's probably what's happening, and it should clear up soon. And that wasn't the case. Now I'm looking back at it. Yes, my immune system probably was very low, but it's because of all the stress that I've been experiencing, everything that's going on in my life. That yes, the reaction of my body to the wisdom tooth surgery was over the top. But yeah, that's definitely not what was causing the pain. And that's just like another symptom of how stressed out my body was.
Right.
So I assumed, okay, this could be maybe a postherpetic neuralgia, because if there was a rash and the pain is still there, maybe that's what it is. So
Right.
I self-diagnosed myself and went to like a walk-in clinic, and I told her, like, listen, I'm pretty sure that's what I have. And they're like, yeah, that's probably what you have, because you're saying that's what you have. So we're going to agree.
Great.
They're not going to fight you. So yeah, the easiest way to go about it is just to give you pills. So they gave me some pills. And in the meantime, obviously, it's just not helping. The postherpetic neuralgia pain treatment, whatever it wasn't helping. So I went to another dentist that previously did a crown on my tooth in a proximity to the wisdom tooth. And I'm telling them, like, the crown is not like done correctly, because the gum has a strange smell to it, and I'm pretty sure it's an infection. So it's just like, no, that doesn't make any sense. Like, the crown is done correctly. There is just like no reason why there should be any pain, any smell from the gum or anything. And I'm like, all right, this doesn't make sense. Like, I'm pretty sure I have an infection. Like the trigeminal, the postherpetic pain treatment that they gave me for the nerve pain is not helping. So it has to be an infection. I mean, it hurts like an infection. It hurt. That's literally how it was. It was burning pain. It was, constant pain. It literally felt like something was inflamed or infected, or just something wasn't right. So it was really hard for me to comprehend that there's just no way there's no infection.
Right. And they checked everything out, and they couldn't find any infection or damage to the tooth or anything.
Yeah. Then I just went to another dentist. They said, yeah, we can like maybe like reseal the crown, but there's no like infection. There could be maybe a food getting stuck, and that could be creating some type of smell, but that there shouldn't be an infection. Like, there's no infection.
Right.
So it could just be like the crown isn't still like great, or but that can be always fixed. But that shouldn't be an issue. So what happened is I was just not able to comprehend that this could be a thing. So I went back to the wisdom tooth dentist, or oral surgeon. He's like, all right, well, you went to the dentist, you went to a walk-in clinic. There's nothing on an x-ray. There's no confirmation of infection. All I can think of is this is just trigeminal neuralgia. I was freaked out by it. He's like, I wouldn't be so quick to diagnose you with that because it's very rare, very rare. And also, I don't want to give you a diagnosis like that because for obvious reason, once you look it up on the internet, it's super scary to give to anyone. But I'm like, no, that's definitely what I have. Like, I'm 100% sure that's what I have. And he just like, let me go with it because for some reason, doctors don't fight you once you diagnose yourself and they don't see any reason why it shouldn't be that. They kind of agree with you and they just send you away. So he kind of tried to fight me off with like, it's not that I want to come to a conclusion, but I already made up my mind. Like, it's definitely trigeminal neuralgia. It's showing all the symptoms of that. And you're saying that it seems like it, so that it has to be that. So he kind of let me go. He said, like, that's out of my competence. I'm an oral surgeon. So this is something I'm going to have to see a neurologist for.
Right.
So I went to see a neurologist at NYU, New York City. NYU is a big, big hospital in New York City. So you would assume it was going to have the top-notch neurologists who know what they're talking about. There's no way to go wrong here. So I had to be in good hands. Like, could I afford it? No, but I was willing to go into debt just to talk to the top-notch dentist on this planet.
Right.
I mean, dentist, neurologist.
Sure.
So I went to NYU and I spoke to a neurologist there, and they basically diagnosed me with it. It was showing symptoms of it.
Based on any physical findings, any imaging studies, or just based on your symptom descriptions?
Symptoms, on my symptoms, but they didn't know the cause yet because first, according to the symptoms, it was agreeing, like they were agreeing on that. It was trigeminal neuralgia. They gave me, I'm trying to think, what is the name of the medication? You see, I already forgot the name of the medication, but they gave me two types. One of them was muscle relaxant, and the second one was carbamazepine, I think. I think it was called carbamazepine. And it's one of them was basically used in case you have, how is it called? When you have, what is this disease called? When you have these attacks, when your eyes roll back and epilepsy. Yeah. So one of them was to treat epilepsy, but they use it for neuralgia. So it's mainly for treatment of epilepsy, but they use it for treatment of neuralgia as well. And the second one was the muscle relaxant. Again, I don't remember exactly the name of it, but these two. And the carbamazepine, they told me it's going to have a bunch of side effects. So be ready for that. And as well as the second medication. But it should get better as you start taking it and as the time goes on. So I started taking it. And the first day, nothing happened. The second day, I woke up and I felt like I was drunk. Like I felt like I drank 10 whiskeys. It was, and I used to be the party girl who always goes out, and I know how feeling drunk feels like, but this was like way over the top, like way over drunk. So I was stumbling out of bed in the morning. I couldn't even, I had this job by then, by the way, I don't know when I mentioned, but by then I was in a full-time position as a sales manager. And I had to go to work that day. And I woke up in the morning and I stumbled out of bed and I couldn't walk straight. It was pretty scary. And I started freaking out because that was definitely, I was not right in my head. And I'm like, I'm going to go to work today. I'm probably going to fall over the train tracks. This is not good. So my fiance decided that it's best if he takes me to my work. So I couldn't even go there by myself because it was dangerous because of all the side effects. And so I got to work, but it was becoming obvious that I'm not going to be able to continue working for this company because I just wasn't feeling like myself. It was really difficult for me to just keep a job like this if I'm going to feel this way.
And how significant was the pain at this point?
Oh, the pain was still there.
Right.
It was doing.
How strong was it? Very bad?
yeah, like nothing was changing. Like I was trying to tell myself that that the pain might be subsiding, but it was more of a placebo, I think. I was trying to tell myself, okay, this medication has to work. Like there's just no way it's not going to work. So it has to work. But it didn't, because I let it, I tried to convince myself for a couple of days, but as days went on, the pain was so strong that there was literally no way that these medications are working. And then every time I told my neurologist, they told me, you just have to wait a little longer. You have to wait a little longer. You have to wait a little longer. But it never, the effects never kicked in. Like I thought that one day I was just going to wake up pain free and just go back to my life. And I don't have to do anything else about it. But that's not true. Like nothing happened. The pain stayed there. It wasn't getting better. And the side effects were so bad. I had to take off, like, I think maybe 2 weeks. I told my boss that I have to take some time off and I have to really kind of wait until the side effects subside, and we'll see what happens. And then I try to tell myself, okay, it's getting better. I can go back to work. But it wasn't. And then I had to quit my job. I had to quit my job at this point. I was just like, okay, the pain isn't getting better. These medications are very strong. I'm probably going to have to go on even stronger medications if these medications aren't working. And there's just no way I'm going to be able to keep on working and be capable,
Right. And now
employee.
talk about more stress, because now you got to quit your job that you just
Yes,
got.
and you have all these medical bills from this top-notch neurologist. So this was horrible. And the second medication I was on, that gave me horrible side effects. So if you thought that these side effects, the first carbamazepine, whatever it's called, if you thought these were good, like these were side effects that were like, okay, well, there's the second medication that's even much worse. Like it was making me like having panic attacks at night. It was making me it was make my heart race. I would wake up in the middle of the night sweating. I would have nightmares. It was just doing a number on me. I took it like once or twice and I was like, okay, I cannot even take these ones. Like one thing is feeling drunk, not be able to walk straight. Another thing is to just have horrible panic attacks.
Right.
So yeah, and what happened after that is
What kind of turned the corner or got you convinced or opened your eyes to the fact that maybe this was a stress response, a mind-body issue, as I call it lately in my videos, perceived danger, pains, and symptoms? So how did you get exposed to these concepts?
What happened is that when I was like a few years back, I had a horrible back pain and I already knew about Dr. Sarno and I was able to treat myself. So I healed myself from back pain before. But I think in the beginning, when we were just first getting on a call, you said that for some reason, trigeminal neuralgia is kind of hard to be conceived as this chronic pain that can be caused by your mind. It's very hard to think of it that way. When it comes to back pain, it's I don't know. It's so
on the
easier.
front of the book from Sarno.
Yeah, exactly.
So trigeminal neuralgia is not. And
Yeah.
I imagine once you had that diagnosis, you started to do some research on trigeminal neuralgia, and you found many of the same things other people with that diagnosis found, which is a lot of darkness and despair and fear and no results, and just really, I think the fear is very overwhelming in that community. The good thing is you at least had a little experience with your back in Sarno. So what made you kind of connect the dots and say, well, maybe this is the same as that? Like, how did you turn that corner?
Funny thing is, I already had an intuition from the get-go, like literally from when it first started happening. There was like a small voice in my head that was telling me this is probably what's going to be it, but my logic wouldn't let me, my rational part of me wouldn't let me follow through with that. Right. So like something inside of me knew that this is caused by all this stress and what I'm putting my nervous system through, and that it has something to do with my previous experience of chronic pain with the back. But the logic would not make it.
You had the tooth, you had the extraction. It was close to the nerve, so you remember these words, and
Yeah.
it's very easy for you to stay focused on the body. Okay.
Yeah, exactly. Also, what was the thing is with the back pain, the pain was intense, but with a neuralgia, the pain was like 10 times of the back pain.
Yes.
So the back pain, I felt miserable. But with neuralgia, I felt like I want to commit a suicide. Right. I literally, that's why it's called a suicidal disease, because the pain was something no one can ever, who never went through it, I don't think they can grasp the level. Yeah. So I think the level of the pain made me doubt the TMS diagnosis, because I never thought a TMS could cause a pain of this degree.
Sure.
Yeah.
I understand. So you started having some beliefs that, well, maybe, and you had, your intuition was saying maybe it is mind body, maybe Sarno's work does apply, but what kind of got you convinced, and what'd you do next?
Yeah. So the medication wasn't working, and I got kind of scared to depend on it, because the longer you take it, the bigger the risk that you're going to depend on it. And that scared me more than anything else. I couldn't imagine depending on medication like that, especially on a medication that doesn't work.
Right.
So what happened is that I went to the neurologist. We already spoke about that. And according to the symptoms, she diagnosed me. But what she also did, she ordered tests. Obviously, they cannot just diagnose and send you away with the medication. She gave me the medication. She diagnosed me according to the symptoms. She also sent me to have an MRI, because it's very important in case of neuralgia to make sure that there is no tumor. So that can be life-threatening. There's nothing to play with. So that has to be the medical. Your doctor has to make sure that there is no tumor. So I went to get the MRI, and there was no tumor, but there was a different physical finding. There was a common physical finding that, according to the medical community, causes this pain, which is the nerve touching the artery. It's very common that they say the reason why you have this pain is because the nerve is touching the artery. So there was a physical finding. It wasn't life-threatening, but she said this definitely means that's why you have the pain. But then,
well, one of the questions I would always think to ask is, okay, so when did the nerve start touching the artery? Hasn't that been there my whole life? And how come it didn't hurt?
Exactly. That's exactly what I asked her in her office. I'm like, I've been living on this planet for so long, and I never had this pain. All of a sudden, after the nerve is touching the artery, the pain starts. Doesn't make any sense. But she's like, oh, what?
What moved? What changed?
Oh, yeah. She's just like, but it's. I don't even know how she explained it, but she's like, it's a different. It's the way it's touching it now, or I don't even know. She had a way to explain it. So a person who is in that office and someone tells it to them, and they will be satisfied with the answer. Like, the answer she gave me was satisfactory. Like, from her point of view, it made sense, I guess. Right. But to me, it didn't really make any sense. It was just too random for it to, all of a sudden, because then she would also think, oh, but it's your it's the structure, it's the way you were born. And I'm like, but exactly, we're going back to the fact that I was born this way and it's starting to hurt now.
Exactly.
So it was getting a little bit messy there with the explanation, but I guess if you really believe doctors, then you would be satisfied with the answer. But it's not that I don't believe doctors, but I still also had this voice, this intuition that it's something that's just, there's no way that this is causing the pain. It just doesn't make sense. I also heard this thing in the TMS community that herniated discs, you can have it and it doesn't cause pain, but you can have it and you can have pain. So And there's a lot of examples in the TMS community when there's accidental findings where you can have pain and the pain is not related to the accidental finding. So
yeah, that's
like I
Dr.
said,
Sarno, TMS 101. These
yeah,
are normal abnormalities, but they're not the cause of the pain. So you were connecting the dots.
So if they would do an MRI of the brain of a lot of people around the world, they probably have a nerve touching the artery and they don't have any pain. So I just assumed because I had this intuition and I also had these medications that weren't working that I didn't want to depend on. And then there's another option, which she was really pushing me towards, was the surgery. But the success rate was so bad when I looked it up. I was scared to lose my hearing or have some other horrible side effects from that surgery. I mean, when I think about the side effects I had from the medication, I couldn't imagine what type of side effects I would have from the surgery. I mean, the pain was so bad. But at this point, I couldn't imagine adding side effects to the pain. Like, yeah. I don't want to have pain and side effects on top of it. That's gonna be unlivable life. So I just decided to walk away from her office and just tell her, okay, I'll contact you if I'm interested to talk to the neurosurgeon. And then I left her office. That was the last time I saw her. And since then, I took matters in my own hands and never came back to a neurologist office or anything. And that was really difficult because I was really in my own hands. And there was nowhere to turn because there was not many success story. Like 3 years ago, it was even worse than it's now. Like I feel like now we have the Tell Me About Your Pain by Alan Gordon on Facebook. We have Curable. We have your YouTube channel. We just have a lot more sources. But 3 years ago, there was barely anything on trigeminal neuralgia. Like there was barely anything out there. That's just how fast times are changing. But yeah, and I had no one to really look up to. There was this wonderful soul on TMS forum named Plum who went through this diagnosis. I mean, that was her nickname on the TMS forum. She went through this diagnosis, and she was probably the only person who really understood what trigeminal neuralgia type 2 feels like, because there was people who maybe went through the TN1, which is the electric shocks, but TN2 is permanent, constant 24/7 burning pain that never goes. Like there's no shocks, there's no periods of relief. It's just constantly there, nonstop, sleeping, eating, talking all the time. So she was like the only person who navigated me through it. I had to talk to her a lot just to feel a little bit better and safer. But that was it. That was probably the only person who could understand me with my diagnosis. So it was us two, the whole forum. It was pretty bad. But she recommended me this book called, it's by Dr. Hanscom. It's about fixing my sleep first, which was very, very hard. In New York City, as I said before, I didn't even realize how badly I was sleeping because I was living in New York City and I barely was getting any sleep because of the noise all the time and the stress and waking up early for work. And I don't know what else was there. I didn't even realize how bad my sleep actually was before this whole thing happened to me. So she told me to fix my sleep first. And so I went about that.
Are you talking about Hanscom's book, Back in Control?
Yes, Back in Control. Yeah, it was again about a back, but not related to neuralgia at all.
No,
but it was
about the mind-body concept.
Yes. Sure. The sleeping part was the most important part to me. So I was teaching myself after I quit my job, how to sleep. It was very hard because on top of that, you have all these financial problems, uncertainty. So how are you going to even sleep? But I had to meditate a lot and trying to just put myself to sleep and try to sleep and relax and just do nothing, complete doing of nothing during the day, just like a child who's just has nothing to do, no agenda. no goals, no hustle, nothing. You're not chasing anything. So I'm very lucky that we were able to survive the financial hardship back then somehow. But because my fiance had to take care of me, so it was difficult times. But I didn't really have a choice. I had to do that. I obviously couldn't keep on working. It would never become better. So I fixed the sleep very slowly. I also got in touch with one of, I think he was a TMS therapist and Mindbody healing. We tried to do meditation over the phone. And he said it wasn't normal how I couldn't even meditate for 5 to 10 minutes because I kept getting these crazy jitters and this horrible fear and fast heartbeat. And he's just like, that's not normal that you are so aroused, like you're hyper aroused, like your nervous system is crazy, like it's fried. You can't even relax for a second. So we were practicing of prolonging the time that I can stay meditating and stay calm and keep my eyes closed and not move and not to get up and do something and just so we were practicing. He's like, it's going to be a success. We get it from 5 minutes to 10 to 15 minutes. And he said, you need to keep building all the way up to an hour. With your nervous system right now, it needs to meditate for an hour a day. You need to build it up though, because right now your nervous system is frazzled. So I was working on that with him. And then what else? Oh, and it was by donation. So it didn't cost me that much money. It was just, it was wonderful that he offered me help. It was just by donation. And what else was there? And then I also was reading Steve Ozannik's The Great Pain Deception. I had to read that like twice. So altogether, I was reading Sarno, Hanscom, Steve Ozannik like twice. And on top of that, Gabby Bernstein's Universe Has Your Back, because I felt like the world is against me. The world is not a safe place. There is always someone trying to either jump you on the street or attack you, or someone's trying to lie to you or trick you or steal from you. Like I was always, at one point I thought someone was going to try to get into our apartment and burglarize us because we weren't living in a good area at one point, living in New York. And I couldn't even sleep at night because I thought our house is going to get burglarized. I was just paranoid about anything and everything. There was a threat on every corner for me. So just reading this book, The Universe Has Your Back, that everything's supposed to happen the way it's supposed to, and everything is happening for you, not against you. All these cliche, maybe quotes were very important for me to memorize.
Right.
And as the time went on, things started improving. The pain was starting to take a back seat, and my life was starting to take the front seat. I got the crown fixed right away. They said, yeah, it was badly fitted crown, but the pain disappeared before I even got the crown fitted. So definitely, the smell that I had on the gum was no infection. And even if there was any infection, that wasn't the cause of the pain because the pain left before the crown was ever fixed. So that's that. Also, I figured at one point, by the way, I knew for sure that it's TMS because it started jumping from the crown to the previous wisdom tooth location to my front teeth. And it was jumping around so much at one point. It was just like, whoa, this is just so funny how it's jumping from one side of my mouth to the other, to my front teeth, to my bottom teeth. It was just like everything. So that was, what is it called? Symptom imperative, sure. I think. Yeah. So once I was onto it, once I really started getting into it, the pain didn't want to give up and started jumping from the previously done teeth to wisdom teeth location there used to be wisdom teeth to my front teeth. And it loved to attach itself to problematic areas. So whether it was the gum that had the smell, or whether it was the previous wisdom tooth location that was
Sure.
operated on, or whether it was a tooth that had a filling. It loved to attach itself to a tooth or a gum that had something going on at the same time. So, it was very tricky because it could have been structural in almost every single case.
Yeah, I think
So,
what ends up happening is as we start to become more convinced that this is not a physical problem and our
mhm.
fear level of the original main location starts to come down, you're still left with a hypervigilant brain and nervous system that's still up here. And
Yeah.
so, it can relocate to a different tooth, a different location. I've heard people say that the nervous system kind of has a memory. So it will go back to a previous location of injury, surgery, dental work,
Ah,
whatever. I don't know if that's exact. I don't know how we prove that, but I've heard that statement a lot. But I do believe that once you became more and more convinced that the original location of the pain was not trigeminal neuralgia, but more like TMS, the mind body stuff, it lost the fear for that location, but your nervous system was still up. So, being a hyper vigilant brain and nervous system, it just moved to somewhere else. And then you had to convince yourself that those other locations were also fine by reminding yourself, well, this makes no sense because it's moving from top to bottom to left to right. It's changing. There's no way it could be structural if it's doing all of that. And over time, your entire fear level of the whole thing kept lowering and lowering, probably to the point that you started feeling better entirely once you convinced yourself that this moving and shifting locations is ridiculous and you lost your
yes.
fear. So, as scary as that jumping and moving can be, it sounds like that may have been one of the keys to you actually seeing how ridiculous it is and how it couldn't be structural, right? Is that
Yes.
accurate?
Yes, definitely.
Cool.
Yes. And
So,
obviously, yeah, um since then, I had pain. I had plantar fasciitis. I don't know if I'm pronouncing it
foot
right.
pain. Yeah.
Yeah, foot pain. I was actually dealing with that for like 3 years. Eventually it went away once I told myself 100% there's no way it's anything else, and got rid of all the how you call it, the foot inserts.
Sure.
So was able to get rid of that. And also, I get this to this day, get into a fight with someone, and I get too tense, and I'm too stressed out, and it's just too much energy all at once. The next day, half of my head is hurting, like a migraine type of pain,
Sure.
and it won't go away until days later. And during those days later, I have to sleep a lot, and I have to relax a lot and not fight with anyone or anything crazy, because the pain would stay for longer. So I'm completely a TMS personality. I probably at this point I at least had five different types of TMS pain throughout my life.
But at this point, the facial tooth pain is no longer.
I'm 100% pain free for almost a year.
That's fantastic. So for anybody watching, uh, listening to her story, the clarity that her body was okay was an extremely important part in her brain accepting and dialing down the fear about something wrong with her tooth. Because every time you'd go to a new doctor and they'd look at this and you're going back in your memory bank to every appointment and how close was that to the nerve, and you're so hyper focused on the physical, the anatomical thing, that your brain's going, yeah, there must be something wrong. We got to keep this pain going. And, I've been speaking a lot about perceived danger as the primary driver behind pain. And so let me ask you, you said at one point you were, TN type 2, which was like constant, super high level, 24/7. When you first started with these pains, was it that painful? Was it that constant, or was it more mild?
When it first started, it was milder. It was not constant. But as more freaked out as I was getting, and
Yes.
more fear I was getting, it was becoming more constant, and the pain level was increasing to the
Right.
point that it made me quit my job and everything. So, but yeah, it started as a mild thing.
And that's instructive because it wasn't so bad, but the more fear and the more freaked out and the more just focused on it, when you start adding fear, attention, fear, attention, freak out, the brain and the nervous system gets more and more sensitive and things start to get amplified. And so I always say in my videos, nobody ever got better by freaking out. And you've proven that both on the way into pain and on the way out, because once you started to get clear and were more certain that your body was okay and that it was TMS, you weren't freaking out as much or anymore. So just notice, the wave of your pain going up and then coming back down. It directly correlates to the amount of fear, the amount of attention you were giving these pains. And so, for anybody watching, please understand that clarity and understanding what TMS is, what this mind body thing is, perceived danger for you went from, I got a wisdom tooth that's hurting to, oh my God, I've got TN type 2 and my life is over. I can't work. I can't do this. Right. And as that perceived danger went up, so did the pain level. Your brain was just trying to keep you safe from something it perceived was really dangerous. But once you lost the danger, the brain says, oh, I guess we're okay. And it all settles down. My recommendation is for the migraines, start to teach yourself that if you have a very stressful emotional event and you feel the headache coming on, very quickly try to put this headache, this migraine, into the very same bucket of there's nothing wrong with my head. I don't need to be concerned with this. Instead of saying, oh, here comes the headache. The next 3 days are shot. I got to go lay down, right? Because it sounds like they're still holding a certain amount of at least worry. Maybe you don't think, your head's exploding, but you still fear, this is going to be a long 3 days. So the quicker you can recognize it for what it is, call it out and say, nope, this is just my brain reacting to, I just had a fight with somebody in your example. There's no reason for my brain to hurt. And let me calm, soothe, breathe, relax, be very clear that there's nothing wrong with my head. I don't need to hurt for days. You may find that the way you respond to these oncoming headaches can greatly influence how severe they are and how long they stick around. So you
That's
have the
true.
experience. I'm just going to encourage you to apply it
Yeah,
to these headaches because it's all the same stuff.
that's true.
Makes sense? Put it in the
Yes.
same bucket where you're not really concerned about that stuff.
Yeah.
You may
No,
find
I'm
that
not,
it helps you.
definitely not that concerned. The only thing is I'm more of a, like, annoyed because then it's hard to walk around with it. It's hard to do anything with it. It's just it's just annoying. But I know it is what it is. Um, Sometimes just part of life.
Okay. So do you have anything that you would want to say to somebody who is having these type of tooth facial pains, is either suspecting that it's TN or have been told directly that it's TN? Any recommendations that you'd give to those people?
Yeah. So I would say that the most important thing is to make sure that it's not anything like a tumor or anything, to have those medical examinations done. And then after that, they clear you off of that and you're just in pain, it's not life threatening, you are good to go. Like, now you can be 100% sure that you are dealing with TMS. And what is very important, I actually told this to one of these ladies that reached out to me recently. And I told her, you kind of have to get a little bit angry, but not angry or frustrated at the pain or angry and frustrated at the fact that this happened to you, but you kind of have to get a little bit mildly angry about the fact that you want your life back and you're kind of tired of your approach to it. So that's the way I kind of went about it. I kind of got annoyed of my whininess and of the fact that I was constantly saying how I want my life back and how I just want to be normal, but I was not really trying to be normal. I was constantly putting that attention on the pain. I was spending time on TMS forums or trying to just find just one more book that I need to read instead of just taking matters in my own hands and tell myself I have control of my own life. And I'm not going to let myself get bullied by this pain. So that's what I would recommend, to kind of just take the ownership of the fact that it's going to last as long as you let it.
Interesting. Yeah. And what you basically said earlier, which I caught, you said something along the lines of, I started making living my life more important.
Exactly.
Than the pain or than fixing the pain. And so I caught that earlier, and that really makes sense. It goes along with a lot of what I talk about, because once you've done the smart thing, you've ruled out the life-threatening stuff. And most people with that diagnosis, hopefully if they're working with a good neurologist, have already done that. They've seen the scans. And so as long as there's no tumor, no crazy aneurysms or anything significant, you're right. Nothing else makes sense. Proximity to nerves, ask the question, well, when did it get that close? You were born that way. Then how come for the first however many decades of my life, I didn't have this pain? What explains it? And so sometimes they'll go, well, we really don't know. And that's when you go, aha, maybe it's not my body. And fortunately, you had the experience of TMS for your back before that was always kind of in the back of your mind going, well, what if? And so that was wonderful. And that probably gave you a nice head start to even looking at the mind body concept, the TMS, as a potential for what was behind it. And it certainly gave you a head start for saying, well, you know, if I take the same approach to this as I did the back pain, maybe I'll get a similar result. And that's exactly what happened. So, you know, instructive here is that fortunately, Patricia was able to dial down the fear with the logic, the reason, the ruling out the horrible stuff. And by dialing down the fear, she was able to shift her attention more towards life. She got a little bit pissed off that I'm not going to live my life this way, which is good. And as a result, you know, she's had the past year where none of this stuff is bothering her. She still has a hypervigilant brain and nervous system because she had some foot pain, plantar fasciitis. She's got some migraines once in a while when she gets particularly stressed out, overly emotional. But the good news is you can now recognize those things for what they are and do the same exact thing, the same approach that goes, hey, don't worry about it. It's your body's fine, right? And I will encourage you to do the same for the headache. And instead of getting really frustrated, oh, here we go, I can't do anything, just get really clear. There's no reason for me to hurt. I just got pissed off at somebody, but that doesn't mean I need a headache. Right?
Yeah, that's correct. So that's true.
You'll have to keep me posted in the future if you're able to kind of minimize these headache experiences by applying the same exact concepts, because I believe you can. I believe you can. And instead of getting pissed off and saying, oh, I'm going to be pissed off for 3 days, you can be maybe a little bit annoyed and go, yeah, but time out. We're not playing this game. We don't have to do this. I don't need a headache. I'm allowed to be pissed off at somebody. And that's so, you know, kind of put it in the bucket of I'm not concerned. And you may be surprised pleasantly at how quickly your brain goes, wow, look at that. She's really not bothered by this. Okay. And the whole system kind of settles down.
Yeah.
Anything else you'd like to add?
I think it's pretty much it. It's very straightforward. It's easier said than done, that's for sure.
Well, I always say that. This is simple, but it's not easy. Right?
Yeah.
And so for anybody with the TN diagnosis type 1 or 2, my belief sincerely, and I've known a number of people who have been able to successfully eliminate the pain completely with this type of approach. But again, I think the fear level in the community, calling it the suicide disease, and how severe it can be, because from everything I've heard, fortunately, I'm blessed I never had it, but from everything I've heard, and I've literally seen somebody on a Zoom call responding to an attack, as she called it, meaning an episode where it flared up, and I'm witnessing it. So it's pretty intense. So we recognize that. Um, Not minimizing it at all. Nobody here is saying that this is in your mind. The pain is so very real, but it's not being created by what the doctors are pointing at. It's being created by a brain that has learned to become more and more and more sensitive, more vigilant as the danger level increases, as in Patricia's case. So did the pain level. The more freaked out she got, the worse the pain got. The more she got the diagnosis. Let me ask you, once you heard this trigeminal neuralgia, what happened to your pain over the next week?
Oh,
It went
that
through
was
the roof.
worst weeks of my life after it was said
Yeah,
by the doctor.
because you
Yeah.
did the research and said, oh my God, is this what I've got? And the danger level kept going up. And the brain just said, holy crap, we're in trouble. And it was
Yeah.
only once you decided, wait, time out, I'm not in trouble, and started being very clear with yourself, did the brain and the nervous system start to settle down. So bravo for you, because that was amazing. Like I said, your previous Sarno experience with back pain was a huge advantage for you. But for anybody who doesn't have that advantage, it doesn't matter. Patricia's evidence that this diagnosis is not a life sentence. You know,
I would just like to point out that after they told me the diagnosis and after I was put on the medication, and that was basically the worst part, right? Once the diagnosis was, set by the doctors. At one point, it got just so bad that I really wanted to commit a suicide, and I had to go to an emergency room. I had to be taken to an emergency room for a suicide watch because I literally kept telling everyone around me that I'm about to be done with this life. So I had to be on a suicide watch. It was very, very dark part of my life. Like a whole day, they kept me there on a watch.
So for anybody watching, nobody is minimizing this. Nobody's saying you're crazy. Nobody's saying it's in your head. Nobody is saying this is imaginary. It's the most real, most significant, most severe pain that I've witnessed as a coach helping people with pain. It is the most devastating to the people I've spoken to with it. And the message here is that there is an answer to it. And if you're watching this video, you're seeing the answer. And the answer is teaching your brain, in my opinion, teaching your brain that your body's okay, that you're not in danger, so that the brain can start to make a different decision about whether or not the pain is needed. Because as long as you're freaking out, scared that it's your nerve, it's your structure of the body, the brain's probably going to keep it going. So getting clear on what this thing called TMS is, this perceived danger pain, this mind-body syndrome, read the books, learn, listen to podcasts, watch some of my videos if you'd like, but understand that, in my opinion, this approach is the answer. Patricia proved it. Can work for you too. And nobody's minimizing what you're going through. Nobody's saying anything negative about you or your experience. Patricia's proof. She went through it. She was right where you may be watching this video, but you see the smile on her face, right?
Yeah.
She's thrilled because she recognized, okay, misdiagnosis, misinformation, too much fear over something that wasn't really broken in her body. And she worked her way out of it, and you can too. So Patricia, thank you so much. I think.
And I have to say, I never thought I would be in this place in my life where I actually have full on makeup and I can put it on without pain. That I go for walks when it's cold outside. I sleep in and don't get woken up by the plane. I have a full-time job. I'm working on so many projects. I exercise, work out. I just have I have much the fulfilling life compared to what I was. Like I was at a point where I didn't want to shower. I didn't want to put on makeup. I didn't want to eat. I didn't want to talk. I just wanted to just lay there. So I cannot imagine, I couldn't imagine myself as a fully functioning person in this society.
So proud of you. That's so awesome. But it was you recognizing it. It was you trusting your intuition that, you know, some of these stories I'm hearing from the medical professions don't make sense. And so you trusted your intuition. And so I really appreciate you sharing the story. I think there's going to be tons of people benefiting by this. And even people without the TN diagnosis will still benefit by the example of the more fearful you got, the worse things got. And the less fearful you got, the better things got. I mean, that's instructive for anybody with any kind of TMS anywhere in their body. So that's wonderful. Thank you so much. I really appreciate it. Any last words?
That's it. I think I said everything I had to.
Beautiful. Thank you again. I appreciate it.